Part 3. This video covers 4 closely related topics that a GAL needs to be familiar with. We will begin with a brief overview of child development, then cover issues surrounding mental health and substance abuse, and health issues and screenings. The video will finish with an overview of developmental disability issues with which a GAL should be familiar. First, let's focus on child development. A GAL needs to have some understanding of the attachment and bonding of the client, as well as the appropriate developmental checklists that can help identify red flags. When dealing with children who have been removed from their primary caregiver, you need to have an understanding of how normal, healthy children develop and grow, including a basic understanding of the key elements needed for attachment bonding and building healthy relationships. This will help you to detect potential issues and to make determinations of best interests. As humans, we create many kinds of bonds between one another. Infant attachment is a special bond characterized by the unique qualities which unite mother and infant or primary caregiver and infant. An attachment bond is an enduring emotional relationship with a specific person. The relationship brings safety, comfort, soothing, and pleasure. Loss or threat of loss of the person evokes intense distress. A solid and healthy attachment with a primary caregiver appears to be associated with healthy relationships, while poor attachment with the mother or primary caregiver appears to be associated with a host of emotional and behavioral problems later in life. This early relationship is not founded on quality of care, but on the nonverbal emotional communication between child and caregiver, known as the attachment bond. Moving a child from her home to a foster home, moving to multiple foster homes, and the trauma of abuse and neglect at a young age can all cause attachment and bonding issues. These are issues to look for in your client, and if you suspect there are bonding issues, you should seek professional assessments or help. Also, it is important that you keep this in mind when you have a client of a young age and are discussing or contemplating moving him or her to foster care or to a new foster home. Bring this issue up with your client's mental health professional and get guidance on how to assist clients with unhealthy attachments. When necessary, you should advocate for these services and assistance in court. Understanding the basics of child development and knowing what to look for during the early years gives you the insight to know when you should ask for a professional review or intervention. The Wyoming Early Learning Guidelines, or ELG, provide a common set of guidelines for development and learning in infants and toddlers, and offers education on how to support high-quality environments. Your handbook provides an ELG chart of what to look for in a young child's development. The chart lists milestones in development and the average age at which each action is achieved. Activities documented include such physical accomplishments as turning, reaching for objects, sitting up, crawling, walking, and climbing. These are general guidelines only. Remember that each child is a unique individual, and that each caregiver's roadmap may differ in how to best provide for a child's needs. You can use these guidelines to come to a basic understanding of child development. Having this basic understanding of normal or average development may raise red flags and cause you to refer a client to a professional for an assessment or treatment. Refer to your handbook, Part 3, Section 2 for the full chart. In addition to understanding the basics of child development, as a GAL, it is important for you to understand when to ensure that your client is screened for mental health or substance abuse disorders, and for you to have a general idea of the services available to your clients. Mental health is the next topic in your handbook. You do not need to be an expert in this area, but rather you must be familiar with the concepts so you can advocate for your clients. This section addresses children or youth who currently have, or at any time during the last year, have had a diagnosable mental, behavioral, or emotional disorder. Criteria used here is specified in the Diagnostic and Statistical Manual, the standard classification of mental disorders used by mental health professionals in the United States. For children, This includes pronounced emotional or behavioral symptoms including, but not limited to, severe withdrawal and symptoms of attachment disorder, autism, and aggressive behavior in more than one setting. More children in juvenile court have these issues than are usually diagnosed. In fact, between 4 and 6 million children and youth in the U.S. suffer from a serious emotional disturbance, and up to 80% of these children and youth do not receive the specialty mental health services and supports they need. So if there is any question, be sure to have your clients screened. In too many cases, a child's experiences inside the system only exacerbate these problems or contribute to new ones. Foster care increases the likelihood of psychiatric impairment, personality disorders, and social dysfunction in adulthood. Children moved from one placement to another can also create or exacerbate attachment problems. Of the 4 to 6 million children who suffer from serious emotional disturbance, an estimated 70% are involved in the juvenile court system. For example, experts estimate that up to 80% of children in juvenile court have a diagnosable mental health disorder, and at least 1 in 5 has a serious emotional disturbance. At least 50% of these children have co-occurring substance abuse disorders. There is a powerful correlation between youth victimization and subsequent mental health problems. For example, nearly 30% of boys who experienced sexual assault developed PTSD. In CHINs and delinquency cases, researchers estimate over 25% of these children have been abused. An adolescent treatment program must use the current version of the Diagnostic and Statistical Manual, or DSM, completing a 5-axis differential diagnosis of the client. At a minimum, the program must use an assessment tool which includes the 9 domains of medical, criminal, substance use, family psychiatric, developmental, academic, physical and sexual abuse, and peer, environmental, and cultural history. A best practice for mental health issues is to reduce restrictive placements in residential treatment facilities, foster care, or juvenile detention. These placements are costly in terms of both monetary and mental health consequences. Recommended services are based on the Substance Abuse and Mental Health Services Administration, or SAM Treatment Improvement Protocol 44 Series publication, Treatment of the Criminal Justice Client. SAM's National Registry of Evidence-Based Practices can be found online on the SAM website. You should routinely review a client's mental health records and treatment plans to ensure the client is receiving appropriate and medically necessary services and medications. If you suspect a child may be receiving a psychotropic medication at too young an age, or too much of any type of psychotropic, or too many different psychotropic medications, you should work with the DFS caseworker or a representative from the Department of Health to request a formal review of the medication. There are a variety of mental health resources for children in Wyoming, including Medicaid and wraparound services, the Medicaid Children's Mental Health Waiver, Uplift, and services provided by the care management entity. In addition, there are local community mental health and substance abuse centers, family treatment courts, DFS contracts with child care facilities and substitute care providers, and psychiatric residential treatment facilities. Refer to your GAL handbook for state statute citations and to the DFS website for a resource guide. To ensure availability of Medicaid funds for the services provided in psychiatric residential treatment facilities, often called PRTFs, the state Medicaid agency must assure federal requirements for certification of need of the medical services are met for each child. The child must have a psychiatric evaluation prior to placement, and this evaluation must recommend that a PRTF level of care is medically necessary. You may have to advocate for your client to ensure these things are done. If your client is in a psychiatric residential treatment facility or a residential treatment center, group home, day treatment, or detention facility placement, check to make sure that the child's basic needs are being met, that is the least restrictive and least expensive alternative, and that it is educationally appropriate. Ensure that treatment is being provided and that the child is not overly medicated and that proper discharge planning is conducted prior to transition back into the community. You may arrange for a client to have a telehealth psychiatric evaluation through the local DFS office or by contacting the Wyoming Department of Health. You should ensure that court orders placing a child at a PRTF are compliant with statute, which directs that any order regarding potential placement at a psychiatric residential treatment facility shall not specify a particular psychiatric residential treatment facility or level of care of the placement of the child. As part of the transition planning prior to discharge, you may need to file motions to ensure community services are in place. You can utilize tools like reentry team meetings or requiring a facility to provide the court with a transition plan prior to discharge to ensure this is done. For an out-of-state placement, you may have to draft the motion and order to ensure it has the correct findings. According to Wyoming statute, the court cannot order an out-of-state placement unless it has evidence regarding the costs of the out-of-state placement compared to costs of a suitable in-state treatment program. In addition, the court must find that no placement can be made in a Wyoming institution that can provide adequate treatment or services for the child, and then the court must state on the record why no in-state placement is available. You should ensure that this information is in the record, motion, and/or order so the placement is not disrupted. The Children's Mental Health Waiver is a Wyoming Department of Health Medicaid program with a limited number of funding opportunities that, by using high-fidelity wraparound, aims to help children of Wyoming reduce their level of service needs and increase their natural supports in a relatively short amount of time. It provides individualized services and support based on the unique strengths and needs of children and youth with serious emotional disturbances in their families. It utilizes a team and goal-oriented process for success. When wraparound and the waiver are used successfully, it can keep youth that need mental health treatment in their home communities. Their parents or families can be involved in all aspects of their treatment, and the children can continue to live at home. This arrangement can strengthen family skills to support the needs of their children, and it can reduce or prevent the length of psychiatric hospital stays. The Children's Mental Health Waiver was developed and is managed by the Wyoming Department of Health, Mental Health, and Substance Abuse Services Division, with the ongoing input from parents, advocacy groups, child serving agencies, and key stakeholders. Children and youth between the ages of 4 and 20 who meet the definition of serious emotional disturbance and meet at least one Medicaid criteria for inpatient psychiatric hospitalization qualify for the waiver. They must be financially eligible for Medicaid based on their own resources, and they must meet certain diagnostic and emotional assessment criteria. An application must be complete, and both clinical and financial requirements must be met before the youth can be accepted into the Children's Mental Health Waiver program. Assistance in completing the application process is available through the Waiver Program Office. Not only should you be familiar with children's mental health issues, a GAL should also have a strong understanding of health issues and periodic screening, diagnosis, and treatment. This topic is covered in Part 3, Section 4 of your handbook. Health care for children in the juvenile court system is essential for their well-being. You are not responsible for diagnosing or treating the client, but you are responsible for ensuring that DFS has arranged for his or her appropriate medical care. This includes applying for Medicaid coverage if the child does not already have access to health insurance and medical care. This also includes understanding what early and periodic screening, diagnostic, and treatment, most often referred to as EPSDT, is and why it is important to your client. Finally, if your client is on Medicaid, as most children in juvenile court are, it is important to know the basics of what this covers for your client's health care needs. The EPSDT benefit provides comprehensive and preventative health care services for children under age 21 who are enrolled in Medicaid. EPSDT is key to ensuring that children and adolescents receive appropriate preventative, dental, mental health, and developmental and specialty services. You should identify if children and youth being served have received the appropriate healthcare services to support their best interests. This may include ensuring the child is referred to the correct provider or is matched up to a primary care physician. When considering a child's EPSDT needs, think early, in terms of assessing and identifying problems early, periodic, and checking the child's health at periodic, age-appropriate intervals, screening, in that there should be physical, mental, developmental, dental, hearing, vision, and other screenings to detect potential problems. Diagnosis, as in diagnostic tests performed to follow up when a risk is identified, and treatment to control, correct, or reduce health problems when found. The state of Wyoming is required to provide comprehensive services and furnish all Medicaid coverable, appropriate, and medically necessary services needed to correct and improve health conditions. These required services are based on federal guidelines and are available under EPSDT. Screening services available through EPSDT consist of comprehensive health and developmental history, an unclothed physical exam, immunizations, lab tests, and health education. At a minimum, diagnosis and treatment for defects in vision, including eyeglasses, are included. Vision services must be provided according to a schedule developed by the state and at other intervals as medically necessary. Dental services include relief of pain and infections, restoration of teeth, and maintenance of dental health. Dental services may not be limited to emergency services. Each state is required to develop a dental schedule in consultation with recognized dental organizations involved in child health. Hearing services include diagnosis and treatment for defects in hearing, including hearing aids. Wyoming is also required to provide any additional health care services that are coverable under the federal Medicaid program and found to be medically necessary, regardless of whether the service is covered in a state's Medicaid plan. When a screening examination indicates the need for further evaluation of a child's health, diagnostic services must be provided. Necessary referrals should be made without delay, and there should be follow-up to ensure the child receives a complete diagnostic evaluation. Finally, necessary healthcare services must be made available for treatment of all physical and mental illnesses or conditions discovered by any screening or diagnostic procedures. When dealing with healthcare issues of clients, the other thing to keep in mind is the Patient Protection and Affordable Care Act. The Patient Protection and Affordable Care Act, commonly called the Affordable Care Act or ACA, is a United States federal statute signed into law on March 23, 2010. The ACA was enacted with the goals of increasing the quality and affordability of health insurance, lowering the uninsured rate by expanding public and private insurance coverage, and reducing the costs of health care for individuals and the government. It included mandates, subsidies, and insurance exchanges with the goal to increase coverage and affordability. The ACA has impacts to children in the legal welfare system. Refer to your GAL Handbook, Part 3, Section 20, for a summary of the provisions in ACA that are relevant to child welfare practices. You will need to have a working knowledge of these significant benefits to properly oversee and advocate for your child clients. Developmental disabilities are the fourth piece of health and development puzzle that a GAL should be familiar with. This is also the final topic for this video. Youth in foster care have a higher rate of developmental disabilities or DD than other children. Types of developmental disabilities include cognitive, emotional, or physical impairment. These disabilities also include impairment related to abnormal sensory or motor development, which may involve a failure or delay in progressing through the normal developmental stages of childhood. The Foster Care Independence Act ensures independent living is accessible to foster care children and youth, including those with DDs. It is important when you represent children with developmental disabilities to understand the importance of early identification and intervention to improve outcomes for children with DDs, as they have an increased risk of homelessness, poverty, public assistance, and lifelong challenges. It is also important to note that services and Medicaid waivers are available for your clients when they become adults, since loss of these supports can oftentimes be the reason why a case does not close. If you suspect that a child or youth may have a developmental disability, the child or youth should be assessed by an appropriate professional for the potential of a DD. However, preliminary screening should be done by a primary care physician as part of the EPSDT services. In order to be eligible for the DD waiver, a licensed psychologist must render an opinion in writing, specifically answering the referral question for clinical eligibility by confirming or denying a diagnosis of mental retardation, IQ of 70 or below, or developmental delay due to a related condition. The psychologist must be licensed to practice psychology by the Wyoming State Board of Psychology or a similar agency in another state. Once the psychological evaluation confirms that the person has a diagnosis of mental retardation or DD due to a related condition, the Behavioral Health Division will arrange for the ICAP, or Inventory for Child and Agency Planning, evaluation to see if the individual meets the functional criteria for eligibility. If the psychological evaluation does not contain a written opinion statement confirming this diagnosis, the applicant will not be clinically eligible for the adult or children's DD waiver. There are a number of specialized federal and state programs available that can help your clients with disabilities gain access to assistance, including financial and medical resources. Supplemental Security Income, or SSI, a federally administered program, and Medicaid waivers offered by the Wyoming Department of Health are two such programs. As a GAL, your understanding of the programs available to your clients with disabilities will help you act in their best interest. SSI, or Supplemental Security Income, is a federally administered program available to children with disabilities. The monthly cash payment provided under this program is used to meet the basic food, clothing, and shelter needs of aged, blind, and persons with disabilities who have a limited income. A child younger than 18 years can qualify for benefits through the Social Security Administration if he or she meets the medical qualifications for a disability and meets the income and resource qualifications. Obviously, youth in foster care are of special concern. For all youth, the transition to adulthood is difficult. For youths in foster care, the already difficult transition to adulthood could be compounded by illness and homelessness if they do not receive assistance. For this reason, youths in foster care must be screened for eligibility for SSI before they age out of the system. Note that this screening is not required in every state. There are two state Medicaid waivers available for youths with disabilities. The first of these is the Child Development Disabilities Home and Community-Based Waiver, the DD waiver, offered by the Wyoming Department of Health. This waiver, administered by the Developmental Disabilities Division, allows eligible youths with developmental disabilities to receive services that are not typically covered under the Wyoming State Medicaid Plan. The waiver provides home and community-based care that allows children to stay in the local community rather than being institutionalized. Children from birth to 20 years old are eligible for the DD waiver if they've been diagnosed with mental retardation or a related condition. They must also meet the level of care for an intermediate care facility for individuals with mental retardation. The Children's Mental Health Waiver is the second type of waiver available and has been previously discussed. As mentioned earlier, this waiver is administered by the Wyoming Department of Health and provides individualized services and support that is intended to keep youth with serious emotional disturbances and who need mental health treatment in their home communities. Children aged 4 to 20 can qualify for the mental health waiver. In order to qualify, they must meet the definition of serious emotional disturbance and meet at least one Medicaid criterion for inpatient psychiatric hospitalization. In addition, they must meet certain diagnostic and emotional assessment criteria and be financially eligible for Medicaid. Many clients present co-occurring diagnoses like a DD and mental health diagnosis, so it is important for a GAL to understand the eligibility requirements and services for each waiver in order to help your client obtain the best and most appropriate service. Your GAL handbook describes these detailed diagnostic and assessment measures.